Okay, what was it in?
In the middle of a pandemic storm, Janice Gucher finds peace by painting.
So the cardinals have been inspiring me lately. So I'm thinking this will be a birdhouse with our little cardinal.
The coronavirus hit the family like a clap of thunder. Janice felt all the symptoms: fever, aches, chills, and more.
I completely lost all sense of smell and taste, body aches. It's scary, and it was scary on a multitude of levels because you don't know what to expect.
But COVID-19 hit her husband Blaine even harder.
I started feeling nervous because I had that cough that developed into like a bruised chest.
Blaine's trip to Cox Hospital turned into the couple's lowest of low points in this battle against the virus.
It was the shortness of breath. I couldn't walk 5 feet without it just taking out every effort I had in me.
I literally pulled up to the hospital and they came out with a wheelchair, and I couldn't even get out of my car. They wheeled him in and I sat there. I had a line behind me, but I refused to move until I couldn't see him any longer. So they wheeled him down the hallway. So that was definitely a gut-wrenching moment for me.
And in a double whammy, the couple took a financial hit. They closed the doors on their restaurant for 2 weeks to make sure the workers and customers stayed safe. And they could have kept all of this a secret, but they shared the diagnosis in a Facebook post.
And we didn't know how people would react. We literally had hundreds of people reach out to us to see if we were okay and to send thoughts and prayers.
Like an artist trusting the process will evolve into a beautiful painting, this couple is hopeful this difficult journey will leave them and all the rest of us stronger.
So we're not going to give up the fight. The solace is knowing that we're all in this together.
He and my mom had a 48-year marriage before she passed away.
Jerry Page did some preaching, played some guitar, and worked as a diesel mechanic. Produced a daughter and sons, too, who loved him. And they noticed something not quite right in early November.
He just wasn't himself. He was not feeling well. He was kind of slurring his words, just not sounding his normal self.
Patty's brother got Dad to Mercy Hospital in Lebanon. Patty couldn't do it because she lives in Florida now. But Patty says the nurses helped melt away the miles.
The level of compassion and love and respect that they gave my dad and us on the other end of the phone was incredible. They made me feel like I was the only patient's family member.
I do remember him very much so, because I was trying to get the admission process completed. He was kind of done with me and done with my questions, but we kind of pressed through it. And every time I'd ask him a question, even as frustrated as he was with me, he'd say, "Yes, ma'am. Yes, ma'am. Yes, ma'am."
Jane Hughes is one of a trio of nurses Patty calls angels.
It is. We always remember that this is somebody's father, somebody's mother, somebody's brother.
In just a couple of days, COVID-19 took Jerry from bad to worse. And another nurse held Jerry's hand and a phone while his daughter said goodbye.
If it wasn't for them, I would never have heard those last words that my dad spoke to me forever and always. And his words were, "I love you, baby." I got to hear those for the last time by Mike holding that phone.
I imagine that gets emotional for you guys too, holding their hand and hearing the voice on the other end of a phone line.
I can only imagine how hard it is for the families to not be able to be there with their loved ones. We do our best as staff members to hold our patients' hands and provide them that love and care that they would get for their families.
I don't know how they do it. I really don't. They are treating our loved ones as their loved ones, and they are so special.
One of the hardest things for me personally was driving away from that ER.
It's a sight of so many unknowns and heartbreaking goodbyes during this pandemic.
The 1st of June.
And the ER date is right there on the wall in Tom Gammon's office. His wife, Joyce, would spend 16 days at Cox South, 14 on the ventilator.
Joyce is very gregarious and loved conversation, loved talking to people.
The virus stole his baseball buddy, his traveling friend, his wife.
I got to go in the room and talk to her and hold her hand. And when I was done, then I stepped out and they came in and took the vent out. And then I went back in and held her hand and talked to her while she passed. I was so thankful that I was there.
Joyce became Christian County's first COVID-19 death, and unlike most survivors, Tom talked about his loss publicly.
I wear a mask out of hope that you never have to tell your grandchildren that their grandmother, their favorite person, had to leave to be with Jesus.
And the further we get into the pandemic, the more people are talking about COVID-19. It's even showing up now in published obituaries. From the loss of a Navy veteran to the death of a former cafeteria worker and a farmer.
That's hard, but it is an honor to be a part of those patients' last moments of care.
Mercy nurse Wanda Brown never really gets away from the virus. She's thankful for the community support and the way people are now openly talking about the potential impact.
This is very real. So I'm glad to see that people are putting it out there that this is actually happening, because it's something that we're dealing with every day. So we know that it's real and that it's really a dangerous situation.
I miss her every day.
Tom and Joyce would have celebrated a 33rd anniversary on December 12th. He feels the best gift he can give her now is spreading the word about the virus, potentially saving another sister, wife, and grandma from a life cut short.
I think it's important that people know that what happened to my family could happen to their family. So when you lose a loved one to COVID, that, that the public know it. My family will never be the same.
There's a race underway to save lives in the battle against the coronavirus. One of the studies looks at the plasma of COVID-19 survivors to see if it will make a difference for others. And one of the researchers behind that Mayo Clinic study has deep Missouri connections.
Hi, everyone.
The plasma study that made national headlines sent hope coursing through the nation. It also carried a somewhat hidden Ozarks connection.
It's a huge honor.
Caitlin Bruno is a Mayo researcher. She's one of the authors of the convalescent plasma study. But she's still the kid born at St. John's, the kid who lived in success, the kid who visited Missouri each summer and on Thanksgiving and Christmas after the family moved, and the woman married in Ash Grove near family that's still here.
I mean, they're proud of me, and I couldn't be more proud to make them proud, I guess. The biggest thing we can do is make a difference for others.
I think that plasma did it.
Claudia Garcineau is a believer in convalescent plasma. NBC featured the nurse recently. She had pneumonia in both lungs, agreed to be part of the study.
I really wasn't a nurse at that moment. I was really a frightened, sick patient who was worrying about surviving.
Claudia is now one of 15,000 in the study. And Caitlin is in the lab, poring over the results. Part of the group who first made sure convalescent plasma is safe. Now they're seeing if it really works to save the sickest of the sick.
We're hearing these stories, these amazing stories about how this plasma is working, but our team is still working on analyzing that data on a large scale.
It's thought the stuff in the blood from people who've recovered from COVID-19, the antibodies, can help patients survive. The biggest hurdle now, getting more of that plasma.
And that's our biggest limitation right now. To be able to treat more patients, we need plasma to treat them. So if you've had COVID, and you're willing to donate some plasma, you can do that, and that would be a huge help.
Most of Caitlin's career focused on a rare disease. Now she's involved in research on a much bigger scale, a much more public scale, too.
I'm a basic scientist. I work in a laboratory, but being able to really make a difference for 15,000 patients or patients across the United States is just a huge honor. To be someone that has something you're involved in, have that kind of scale is just absolutely amazing.
Well, here's the plasma donation website right here that Caitlin mentioned. And you look here, it's the COVID-19 Expanded Access Program that Mayo talks about. You click on this here that says donate your plasma. You can put in your zip code, and we have two listed on their website right now, the American Red Cross and the Community Blood Center of the Ozarks.